next speaker is Dr. Keiki Mehta, the king of Mumbai, and he's going to tell you how he's practicing like a king.
I almost feel shy to
Hi.
speak in the middle of this session, which have kings like L.V. Prasad and a whole host of other internationally and nationally famous organizations. I'm basically a private practitioner, and I'm going to talk to you on something totally different. I'm going to talk to you on how you practice literally as a king. When Partha Viswas told me that I have to speak in this session, I told him, I'm a misfit here. Why are you putting me here? He says, we want to know how you manage. So I said, okay, so this is my talk. We know as a person, we are now talking to you as a general practitioner who is now going to increase his effort. If you remember the last slide of our talk from Chandigarh, Dr. Pandey said, no pressure on generating funds. I am a practitioner. For me, there's great pressure on generating funds. So we start with that. You may know everything about ophthalmology, but the most important commodity is marketing yourself. Now, when you market and sell, you sell a system which is known as sell the sizzle, not the steak. What it means essentially is it's the most popular axiom in advertising. It means that instead of selling the product itself, you must want to make the patient want it or need it. In other words, an emotional response has to be created within the customer. To give an example, when you buy a car, you have a certain vehicle and a minimum price. You want to reach out to a potential customer. You want him to make him feel how a car feels like. Will it make him feel safer? Will it be cooler if he buys this car? Will he be willing to go? And that is essentially what we need to do. A classical is a little ad. It doesn't talk about the soap, it doesn't talk about anything. It just talks about how happy the lady is after utilizing little soap. So, this is essentially what you need to do as far as it is concerned. So, you sell the sizzle, not the steak. You sell the benefit, not the features. Sell what people want, not what they need. Unfortunately, people buy on emotion. An important fact, face it, people don't care how long you struggled, how much you've invested, how many years of your life. They want from the customer's point of view, it is very simple. What is in it for the customer? And that is what you have to satisfy. A person needs to decrease his number, even a single LASIK, a simple LASIK will do. He wants to get a better procedure, he has to go for femto LASIK or smile. And how do you make him to go for the latter procedure? You sell the sizzle, sell the benefits, better vision, sharper vision, minimal complication, and the important what we call is brag factor. You tell your friends you had the newest procedure done and better long-term benefits. And remember, in the end, no one is more important than yourself. Remember to sell yourself, not a machine. Unfortunately, nowadays, if you see brochures of doctors from all over, the brochures are filled with pictures of machines on both sides. Why are you selling the machine of the company? For God's sake, sell yourself. You are unique, a machine is not. Today you have it, tomorrow your next door neighbor will have it. If you stress on the machine, there will be no differentiator. Always stress your abilities. In a similar vein, stress on the surgeon, not the machine. People say, I have got this LASIK machine, yeah, usme kya hai? People are not bothered about what machine you have. When was the last time you went to a five-star hotel and asked us to what cooking range is the chef cooking my food on? You're not even interested. You're interested in the ambience. So sell the uniqueness of the operator, not the vehicle or the medium. You are special. Send the unique level. For example, there are multiple lasers. There are no differentiations, but the operators are unique. Remember, it's the driver, not the car, which wins the races, and you have to tell the patient that. It is the jockey, not the horse, that wins the race. Neither. So you stress on your assets as a surgeon, your success rates, the number of years you've been practicing, the good results you're having, where you get patients from so far. And when you sell cataracts, refractive procedures, even smile, stress the benefit, not the procedure. Don't run and say "Okay, it is a new procedure." The advantages of 24 are good vision, ability to get 180 degree, no poking, etc. As we say, sell the sizzle, not the steak. Sell long-term benefits. Always stress on long-term. Advise her she's not buying a shoe or chappal or a costly bag. This is forever. So when you have to sell a lens, especially, you suggest them that this is something you're going to be using for a prolonged period of time, and how to differentiate yourself in a market which is very competitive. Like for example, where I live in Bombay, you are born unique. Focus on yourself. Sell yourself. And of course, a very fundamental thing: don't make patients wait in a waiting room. Nobody likes waiting. First of all, remove the name waiting and call it reception room, and try to keep your appointments and make sure your signages outside are adequate, irrespective of how small a clinic you practice in. The biggest thing in your practice should be your signboard. And the key to a successful practice is availability. You should be available to your patient all the time, and they have to know that you are available. Email, phone access should be available on a 24-hour basis, more so if you handle email patients. And of course, social marketing, a powerful tool. You need to be able to target your audience carefully. Use Google, it works well. Use Facebook, but update often. People put one page and they stick on it as if it is an adhesive. Change it. Bottom line, be enough time to at least a few topics every week. And healthcare on Instagram. Instagram is one of the most important social networks. Practice well, and all will bow before you. Thank you.
Thank you very much, Dr. Keiki. That was wonderful. I mean, like being in a solo practice and to do achieve what all you've achieved today, I think it's very commendable. Thank you so much.
Thank you.